I found this disturbing when I saw this headline. I got Dr. James Pickney on standby here to comment on this from Medscape. And this survey that Medscape conducted, it's a good one. 15,000 doctors. And nearly two-thirds of them claim that they feel burned out or depressed. Dr. James Pickney joining me on the wall. Okay, Dr. James, before we start this conversation, are you burned out? You depressed?
I'm not burned out, Sergio. I have a different lifestyle, though. I'm a direct primary care physician, so I believe that this new model is the solution to physician burnout and physician depression. So I feel great. I'm good.
What's wrong with all these doctors? Man, they got luxury vehicles. They got, six-figure mansions. They got six-figure, at least seven-figure salary for some of these individuals. What's wrong with these dudes? Why are they all depressed and burned out? They got a nice
I don't
lifestyle.
know about that,
Huh?
Sergio. That's a very small percentage of docs that are making seven figures. I think that's a little bit of a misconception that doctors are filthy rich these days. And in fact, it makes more sense to be a dentist from a financial perspective than to be a doctor. But nonetheless, the traditional insurance model is very taxing. You get 7 minutes with your patient. It is a volume-based model, so you have to see 35, 45 patients a day to keep the doors open. And that is a recipe for burnout, recipe for disaster. No time with your family, charting for 3 or 4 hours after you finish clinic. The system has to change.
Okay, please explain that for me. Explain to working people driving around town right now listening to the Wall program. Explain to them why only 7-ish minutes per patient, how they need to truck in a bunch of people. Because, see, that affects us. All we know, on our end, is that we're sitting there in the waiting room for an hour and a half, 2 hours, maybe more than 3 hours to see our doctor, and we feel like cattle. Oh, why is it like that right now? Why is the system this way?
I know, it's horrible on both sides, physician and patient. And it's because of third-party payer system. Insurance has gotten in the way. Insurance and bureaucracy have gotten in the way of patient care. And insurance coverage is not equal care. So when you develop a system where you have a different party paying a doctor that's rendering a service to a patient, so it's a triangle, right? Patient, doctor, insurance provider, it becomes a complete convoluted mess. And that's why reimbursements have been going down for doctors. Patient visit time has been going down. Wait time has been going up. Access is declining. Doctors are getting out of medicine left and right. They're quitting. They're burnt out. They're depressed. So we have to flip the script and change the entire mantra. And that's what we do at Diamond Physicians in Dallas, Texas. We reinvigorate the patient-physician relationship. So it's Sergio, it's you and me. That's it. No insurance, no bureaucracy, just you and me, one low monthly fee, and that solves the entire issue. 30-minute, 45-minute, hour-long visits instead of 7 minutes.
That's a local-based solution. Diamond Physicians, North Texas, Dallas area. How does it work? People are pre-purchasing the services, much like a local insurance or a little co-op. What is it? Can you explain how it works?
Well, it's not a co-op. It's actual health care. So think of it like a gym membership. First of the month,
All right.
You pay your gym membership. You have unlimited access to that gym for the next 30 days. If you don't like it, you cancel the membership and you go somewhere else. Same thing with direct primary care at Diamond Physicians. You pay a monthly membership fee. You get unlimited visits, no copay, 24-hour access to your doctor, unlimited urgent care. So no more of these freestanding ER visits and urgent care visits that cost thousands of dollars. You have your own private /ER/urgent care facility. And we throw in 90% discounts on labs and imaging. So if you tweak your knee, Sergio, and you need an MRI, $350 out the door with radiology read instead of $3,000.
I need to have a
So at the end of the day, if you have a high deductible plan, it makes more sense to add on a direct primary care model, and you will save a tremendous amount of money and have unbelievable health care.
How much is it running monthly? Ballpark.
Nationwide, it's anywhere from $50 to $150 per member per month. At Diamond, we're towards the higher end. We're closer to $150 a month, but it depends on the area that you're in. And
is that a family plan or is that an individual?
That is per individual, and kids are typically around $75 at Diamond Physician.
All right. Per kid or family?
Per kid. Per kid.
So do the math on that one. Still, unlimited access, primary care, discounts on radiology, discounts on pharmaceuticals, all that. And then you come out winning.
90% off generics, 90% off labs. I mean, It is the solution to the largest healthcare crisis that this country has ever seen, and physician burnout. I mean, one doctor commits suicide every day, and that is a travesty.
What?
We've got to do something about the situation.
Financial troubles or what? Is that what it is?
Depression. Unhappy with the lifestyle. And that's why these young kids aren't going into medicine. And eventually, if we don't do something about it now, we're not going to have enough. We already have a huge physician shortage, but it's going to be even worse. We're not going to have enough doctors to take care of everyone.
Dr. James Pickney, Diamond Physicians, Dallas area. Look it up, Diamond Physicians. Learn more of that. Well, I really wish you would visit the Rio Grande Valley, James, because you know what saddens me? What depresses me in this impoverished area of the state that is working mightily. We're working mightily to lift ourselves up from this poverty. A lot of kids, by the tens of thousands, getting an education in technical school and college down here. We got about 70, 80,000 people going to college, either junior college or the university down here in our area. So we're climbing, and we're doing our best. We got a medical school now and all that. But you know what I'm seeing, James? I'm seeing a bunch of regional ER offices. You know, those satellite emergency room offices? They're popping up all over the place, man. I see that. All I see is dollar figures, man. I don't see. We need urgent care facilities down here desperately, Dr. James. We need a bunch of these urgent care facilities that's affordable medicine, and we don't see that. They're investing in fleecing the population, and that's unacceptable, man. I'm just going to say it.
It is. I've got something for you right now, though, Sergio. I've got something that I just launched. It's called Dr. Link. It's $60 per person, adult or child, and it's unlimited visits, unlimited virtual consultations with the same provider. So it's not your typical telemedicine solution. It's the future of telemedicine. And, you know, your listeners, you can go to thedrlink.com right now, thedrlink.com, and find a physician right now for $60 a month that will refill your prescriptions. You can call them, you can text them, you can FaceTime them, you can do all these things 24 hours a day, same doctor, to get your needs addressed in a timely fashion. So it's not the urgent care solution, but at least it's a start.
Cash clinics, urgent care, this outside the box thinking like Diamond Physicians, like a gym membership, you prepay your services. How much money are you blowing on a gym membership that you're not even using, people? How about it? We need this in South Texas desperately, Dr. James. Someday, brother, I hope to see you down here. You and
I'm coming down.
Please.
I'm coming down.
Please. You call me before you come down here. Let's talk about this at length, okay? Thank you, Dr. James. Dr. James Pickney. Look it up online. Bing the thing or Google. Diamond Physicians. They're in North Texas. We need that in South Texas. We need cash clinics. We need urgent care facilities, affordable medicine. We don't need more satellite emergency room offices popping up all over the place. Thousands and thousands of dollars in debt for people that need medical attention, but they're not dying. Man, we need to educate the local population on medicine and medical care.